Ready to go? Well, thank you all for coming. There's a few things to get through today following our meeting of National Cabinet yesterday, and we held a COVID and Economic Recovery Committee earlier this morning. Today I'm joined by the Health Minister, Brad Hazzard, our Chief Health Officer, Dr. Kerry Chan, and the Acting Commissioner of New South Wales Ambulance, David Dutton. Firstly, can I begin by thanking our frontline health workers right across the state who have done an amazing job over the last 2 years, and particularly going through this most recent period of time with significant vaccination and now booster shots required. I really want to thank you on behalf of the government, on behalf of the people of our great state, for the continued effort you make in keeping our people safe as we move through this pandemic. If you look at the booster shots, they are incredibly pleasing numbers, and I want to thank the people of New South Wales who have gone out. If it's been 5 months since your second vaccination, the booster shot is key to keeping you and your family safe. And to see now that Health has administered 158,000 booster shots as of the 22nd of December is incredibly pleasing. I want to particularly thank our GPs and pharmacists who are also carrying out those booster shots. I congratulate the Prime Minister and the Federal Treasurer for their decision yesterday to provide additional financial support for our GPs and pharmacists who will be taking a heavier load when it comes to the booster shots over this period of time, particularly over the next 4 months. But to everybody right across our state, can I please say, if it has been 5 months since your last vaccination, please go out, receive that booster shot. We have 40 centres, 40 vaccination centres across our state, 100 mobile centres as well, and we will be getting to around, from the New South Wales government's perspective, around 300,000 booster shots per week as we head into the third week of January. So that will be crucial. It's our best line of defence as we move through this next phase of the pandemic. So I want to thank everybody who has gone out and made the effort. I know we're heading into the holiday season, but please don't let your booster shot be part of that holiday. Please go out and get that shot and make an appointment where you can. The other point I'd make today, which came through National Cabinet yesterday, which the early signs are very pleasing, and from the advice that we received from the Chief Health Officer, Dr. Kerry Chan, this morning, is that we're seeing it looks like that Omicron will be 5 times less severe than Delta. So those early signs are very pleasing, but obviously we need a bit more data and a bit more time as we move through. We do know here in our state, the majority of people who are contracting the virus at the moment are generally younger people. So we'll keep monitoring that situation as we move through this phase. But I want to particularly note that the early signs here, the early signs are encouraging. And I note the Queensland Chief Health Officer's comments this morning in relation to Omicron, and I think as a nation we're seeing that as we move through this next period of time. We've always said as we've moved through this that we will monitor the situation and the evidence in front of us. The key indicators to us are not the case numbers, but rather ICU numbers, hospitalisations, and in addition to that, importantly, the ability of our healthcare workers here in our state to provide the care that people need if they're seriously ill as they come into the hospital system. What we're seeing at the moment is that many of our health workers, around 1,500 just today, are either sick or unable through testing requirements to be able to come into work. We need to ensure that as we move through this next difficult period, that support and care is there. So this morning we made a number of changes over this period of time, and I'll quickly run through those now. As of midnight tonight, we will be requiring that masks are worn in indoor settings. We are encouraging people, particularly over the holiday period, if you can work from home, please work from home. We do want to limit mobility just as we get through this period of time, and particularly in relation to ensuring that our health workers are able to be on the job and provide that care and support for those who are unwell. We'll be moving from for hospitality venues indoors to 2 square metres from December 27 to January 27, and also that indoor face mask requirement will also be in place until January 27 as well. So December 27 in relation to 2 square metres, and that's just to ensure that as we move through this period of time, we do have that support for our health officers over this summer and holiday period. In addition to that, we're also encouraging people not to mingle, and when you're out and you're out at a restaurant, you're out at a cafe, you're out at a pub or a club, please, where possible, don't mingle. We know that from the case that we've seen in Newcastle that singing and dancing and the like has been a part of that increase in spread. So we just ask everybody, use personal responsibility. Please be cautious as we move through this phase. The other aspect arising out of National Cabinet yesterday was the national agreement to put in place QR codes. Many of you will be aware we've had those QR codes in place for some time. We kept them in place for high-risk settings. What we will do in relation to retail settings and lower-risk settings is we will bring them back in a limited way. The reason we removed those QR codes, I think, has been slightly misunderstood. It's not actually in terms of opening up the economy, it's to provide that support to the health system. And so Dr. Kerry Chan will provide a bit more advice in relation to that. But what I would say is that if you have been into a setting and you have checked in and you receive a notification from Service New South Wales that the number one position is that you monitor for symptoms, and if you do not feel unwell, you don't need to be tested. At the moment, what we're seeing is that many people across the state who are asymptomatic, who do not feel unwell, are lining up for a PCR test. This is putting enormous pressure on the system, and I thank everybody for their patience as we go through this period of time. But we need to make sure that those people who need to get tested in a timely way, and importantly, that we get the results back to people as quickly as possible. So if you aren't feeling unwell simply because you receive a notification through the QR code system, the position that we have here in New South Wales is monitor for symptoms. If you do feel unwell, at that point in time, please go and get a PCR test. But if you don't feel unwell, there is no need for that testing to occur. That will help alleviate some pressure on our testing centres right across the state. Obviously, I want to thank everybody who has gone out, close to 150,000 tests today. The other point I'd make here is in relation to, and thank the other premiers around the country. There are obviously requirements in place at the moment, as the Health Minister labels it, the tourism testing. I want to thank particularly the Queensland Premier Anastasia Palaszczuk, who's announced that she will remove that requirement and transition to a rapid antigen test from 1 January, because we're seeing in respect of testing, around 20% of those tests that are occurring are for the requirement of interstate travel. That is putting substantial pressure, and I'll continue to work with premiers across the state to transition from that system of a PCR test to a rapid antigen test. That will reduce the lines, and what it particularly does, and I say this to the other state premiers around the country, what it does is it ensures that those people who need a test get a test, and importantly, we can get the results back as quickly as possible for those who are sick and unwell. So I thank everybody for their patience. I do know that there has been a fair bit of frustration out there. Many people waiting hours in queues, particularly as we come into Christmas. We're doing everything we can to alleviate that pressure. The two things we can do is move away from that interstate PCR testing, and in addition to that, if you're unwell, so for those people from New South Wales, if you aren't feeling unwell, please do not get a PCR test, because you're taking the place and extending the queue for someone who is unwell and sick at this time, and we need to get those tests back as quickly as possible. In addition, today we also made an announcement in relation to rapid antigen testing and providing free rapid antigen testing into next year for people right across our state. We see this as crucial as we move through this next part of the pandemic. We need to move away from PCR testing. We want to make sure that we drive personal responsibility, that we will play a role here, and I've tasked the Investment Minister Stuart Ayres, the Health Minister Brad Hazzard, and the Finance Minister Damien Tudorhope to work towards providing free rapid antigen testing for people right across our state. Now, this will help people in circumstances where you're going into a high-risk setting or you're visiting an elderly loved one, that in those circumstances as we head into 2022, as we move into this next phase of the pandemic, you simply take a test at home. If it's a negative test, that will provide confidence system, and more importantly, confidence to you that you're COVID-free and being able to go out and visit your loved ones and visit high-risk settings as we move into next year. So, in conclusion, we believe today's changes are modest, cautious. It takes a precautionary approach as we move through this holiday period to the end of January. The system is in a very strong position. Our ICU numbers remain low at 45. That is incredibly pleasing. Obviously, there is concern in relation to our health workers. We believe the changes that we are making today will ensure that our health system is well manned over the holiday season as we go through this next stage. Our number one priority is to keep people safe as we continue to open up the economy safely. We're incredibly confident that New South Wales and our great people have made enormous efforts and sacrifices over this period of time. We've got through the last 18 months and 2 years of what's been an incredibly challenging time for the people of our state, and we have complete confidence as we head into Christmas that New South Wales will come through stronger out the other side, and that we're in for a very bright summer here in New South Wales. I'll finish just by making the point that over this period of time, please treat everyone with kindness and respect, particularly those people who are working on the front line in our health system, who are doing the tests. Whilst they're frustrating sitting in those queues, that's not the fault of the person who's conducting the test. They're doing everything they can in difficult circumstances to help everybody get through this challenging period. So I have strong confidence that we'll get through this summer. It's going to be a great summer for the people of our state, and I want to wish everybody, to you and your families, a very Merry Christmas. I'm now going to pass to Minister Hazzard, who will back in some of those health statements. I'll then pass to Dr. Kerry Chant, who will provide a public health update. Then we'll hear from New South Wales Ambulance into some of the challenges that we're seeing right now. In a similar vein to the QR code challenge, to the testing challenge, we're having many people contacting our ambulance service for non-urgent medical matters, and New South Wales Ambulance will speak to that.
Right. Thanks very much. Look, I'd just like to start off by saying that obviously the Omicron virus continues to be somewhat challenging. It's very transmissible. As the Premier said, so far it hasn't been causing the level of anxiety medically that previous variants did, but we're on high alert. Government's on high alert. I think the community should be on high alert. We don't know yet. It's too early. No one in the world knows yet exactly what the implications of Omicron will be. So this precautionary steps that the government has announced today, some are commencing, particularly the mask wearing tonight, just after midnight, and others commencing on the day after Boxing Day, are just sensible, modest changes. But I think they do indicate to the community that everybody needs to be on this journey with us, and we need to be careful. This press conference is taking place outside in the fresh air. Anything you can do over the next few days, if you're having some people around to your house, try and do it out in the balcony or out in the backyard, or if you can't do that, open all the windows, because what we do know is that Omicron's not terribly successful when it's out in the fresh air. It tends to get us when we're inside in closed environments, so be very cautious. Obviously the testing is a bit of an issue for us because, as the Premier said, very high testing. I mean, go back 22 months, we were excited when we were up around about 40,000 tests. We're now 4 times that amount, 160,000 tests, but it really is sucking the energy out of all of the frontline pathology workers, the people who are doing it, people who are doing the tests, people who are then doing the pathology examinations in the laboratories, the administration people who are sending the details out. So I would ask everybody just to listen very carefully to the message that if you don't need to go, if you haven't got symptoms or you haven't received a message telling you that you must have a PCR test, probably you don't need to have a PCR test. And certainly if you're going visiting over the next few days, please don't go out and just grab a PCR test for the sake of it, because next time when you do need a PCR test, seriously, you may not be able to get it because too many people just go out and use our pathology system to that extent. So if you're going to go and see, Nan and Pop or or your friends and you feel like that you need to get it checked, use a rapid antigen test. Rapid antigen testing is not quite as accurate as PCR tests, but they are certainly very good for the purpose of if you're going to go and do a visit. We're here today, of course, with the Chief Health Officer, who has given us advice about the range of issues, and they are challenging issues to do with Omicron. But we're also here with the Acting Commissioner Dave Dutton from Ambulance. It's very frustrating for me as Health Minister to have heard that ambulances are being called out at a time when we are so busy dealing with Omicron. Our hospitals and our frontline staff are so busy that people are still thinking that ambulances are for something other than emergencies. They're not. Ambulances here for emergencies. Now, Dr. Chant would tell you, and all other doctors would tell you, if you're having some sort of serious issue, you know, you've got chest pain or something, well, call an ambulance. If you need a Band-Aid, don't call an ambulance. And yet we're actually seeing people still doing that sort of thing, and I'm sure Acting Commissioner Dutton will fill us in on that. The other thing we're seeing is because of the long waits for the queues, perhaps, and because it's the time of the year when everybody's out a bit frustrated, looking forward to fabulous Christmas, but also the pressures as it leads up to it, we're actually having health staff who've given up their time. They're not on holidays, they're working, and yet they're being abused. All across the state, they are being abused. I cannot tell you that how unfortunate that is, but also very disappointing, I think, for the broader community to hear that. Please do not abuse staff who are there to help you. Now, on the booster side of things, what we do know is that boosters are certainly helping boost your immune system. So if you're eligible, make sure you go and get it. I was really quite disturbed to hear that we had vacancies for 35,000 people just in the last few days, and they weren't taken up. I would strongly suggest that people get on to, if you're eligible, get on to nsw.gov.au, our old and trusty website, and book in. Get yourself a booster if you're eligible, because we do know that particularly for older people and those who had AstraZeneca, whilst it was fabulous for the time, it does have its challenges now and its waning effect on immunity, so we need to get a booster. I was one of those. I went and got mine a couple of weeks ago, and I think everybody should. If you've had the AZ and you're eligible, go and get it. I also just want to point out that we've had quite an increase in the bookings. Only 2 weeks ago we had 15,000 bookings. Last week we had 61,000, so the New South Wales Health Team have really stepped up because the community have come in and are actually getting the testing. But there's, as I said, there's spaces, and we need you to get out there and do that. And my final message. In the last couple of weeks, I mean, we know we get the daily announcements on how many people are in ICU, but I want to stress that people come in and people go out from the ICU. Obviously, that's a good thing when they go out of the ICU. But we've had about 60 people in ICU just over the last week and a half, 2 weeks, and 65%, more than 2/3, are unvaccinated people. Unvaccinated people. My message to those out there who think this is still some sort of Pixieland argument that it doesn't exist is it does exist, and you might be one of those 2/3 who've ended up in our ICUs in the next week or 2 or 3. It might be you. This is your chance to take it seriously, come out, support yourself, support the community, support your family, and get vaccinated. There are opportunities to do it. Don't end up in ICU. Don't take any notice of the social media. I've yet to see any really qualified scientists or experts giving anything other than qualified scientific advice, but I've seen a lot of wacko advice on social media. Don't take it seriously. Get vaccinated.
Thanks, Minister. I thought I'd just take this opportunity to just give a bit of an update of where we are with Omicron and Delta and COVID in general. So New South Wales is currently experiencing both the circulation of Delta and the Omicron variant of COVID. Approximately 80% of our cases are currently Omicron, and the increase in Omicron largely explains the steep rise in cases. The Delta case numbers did start to rise in mid-December, but we're now seeing Delta as a proportion of cases declining, and that large uptick being accounted for by Omicron. Pulling together multiple pieces of evidence from overseas countries such as South Africa and the UK, and using some of our own emerging data, it indicates that infection with Omicron is likely to be milder than infection with Delta, with the risk of hospitalisation being around 60 to 80% less than for Delta. But the issue is the increased transmissibility, leading to high case numbers, and the impact that this is having on vulnerable settings, vulnerable people, and critical workforces, such as our health and aged care workforce. And also, it's important to remember that more cases across the population can lead, even if a smaller proportion of them lead to hospitalisations, you can see higher hospitalisations overall. And that's why we're taking a very cautious approach to monitoring the situation. We're also working hard to generate our own evidence, because we're drawing experiences from countries overseas that have had previous waves. So I want to thank all of the staff that are really helping pull together that local data to inform our risk assessment in relation to the Omicron. There is a lot of good news though, and the good news is that booster doses will increase your protection and probably will have an impact on transmission. And that's incredibly important. So can I just echo the Minister and the Premier's message? Get vaccinated. And it does really, every day I look at the new admissions to ICU, and I look at the age range, and I look at the vaccination status. And it's really sad to see some very young people in ICU who are not vaccinated. So again, a big call out to everyone. Just because you're young, this message we've been saying for a long time, you're not necessarily going to be lucky enough to have the mild disease. You can be hit hard. Please get vaccinated, get your first vaccine, get your second vaccine, and get your booster. So I just want to talk about the transmission settings. So at the moment, COVID's circulating in a very young population relatively. And over about 70% of cases are in that age group of 10 to 39-year-olds. Very young. And we're seeing lots of cases arise in social settings and through social networks. And I think increasingly everyone probably has been touched by someone in their social network that has COVID. Now, obviously, we do want to see people get out and about and socialise. I think it is important as we transition to living with COVID. But at the moment, with the transmissibility profile of the Omicron variant and the fact that you don't have the transmission prevention benefit from the vaccine, we are actually seeing an escalating case numbers. So hence the cautious advice that the Premier has provided. We are introducing those density restrictions in those hospitality settings and really discouraging activities that we know are associated with increased transmission risk. That's singing, dancing, things that often are associated with fun. So sorry, at this time of year, we've just got to tell it as it is in terms of what are the things that are associated with risk, particularly in indoor environments. So please take those activities outdoors with lots of social distancing. Now, the other component is the QR codes. Just wanted to let you know. So what we're using is we've retained QR codes in those higher risk settings, and we're reintroducing them in some of the lower risk settings. But really they are there for the purpose of reminding people. They're a prompt. They tell you that someone else in that store has got COVID. But particularly given we've got the masks now on everyone in a retail setting, I've got to say that the risk of acquisition in a retail setting, if you're maintaining that social distancing, keeping those masks on, it's a lower risk setting for us. The settings we're really worried about are those indoor settings where there's a lot more interaction and mingling between people, and particularly at settings where you're actually having to remove the mask for doing the things that you need to do, such as eat and drink in those settings. So in terms of the QR codes, we will be having a tailored approach to retail, and it may be, for instance, that when you're going into the front of a retail set of shops, that there's some QR codes that you can sign into at various points, but you don't have to stop in front of every single store in that centre. And that's because we don't want to have people bunching up there. We don't want to have someone having to interact with multiple people. That actually increases risk. And that's in recognition that those settings are much lower risk, particularly when both people are wearing masks. So my messages are get vaccinated, wear a mask, only get tested if you've got symptoms or if health directs you to, or you know that you've had contact with someone that's COVID positive. So now in the current settings, New South Wales Health will be contacting and focusing our efforts on people that have entered or worked in high-risk settings. So what we're doing currently is we text people that have got a positive result. We give them advice about what they need to do to self-isolate, but we also ask them to fill an online questionnaire. And about 80% of people do that. And can I thank you? And can I ask everyone to really help us by filling in that questionnaire? That questionnaire asks us whether you have been in a high-risk setting, whether you've been in an aged care facility, an Aboriginal community, a disability group home, a corrections setting. And then we use that to call those people and prioritise those people for personal interviews. So there will be many people that just receive the text information, the isolation information, and we ask those individuals to let their household know that they're positive, and to also let any of their social contacts that they've just had a party with know that they're positive. But the ones that health will be focusing on is particularly those ones that indicate they've worked in aged care, been in hospitals, or those sensitive. And that's a reflection of the case numbers, but it also reflects on public health prioritising our focus on the most vulnerable. Thank you.
Thank you, Dr. Chan. Every Christmas and New Year is a busy time for New South Wales ambulance paramedics, and this Christmas New Year is shaping up in exactly the same way. Yesterday, we answered an emergency 000 call approximately every 24 seconds. We're asking to save 000 for saving lives. I want to be really clear. If someone is unconscious, if someone has chest pain, if someone has shortness of breath, if there are injuries as a result of a motor vehicle accident, please call emergency 000. But I want to be equally clear on the following points. If you can't sleep, if you have a toothache, if you have a splinter, if you want to check the opening hours of a testing clinic or follow up on a COVID vaccination, please do not call emergency 000. Those calls that I just referenced potentially delay New South Wales Ambulance mounting an emergency response to a member of the community that really needs it. The way that we can all be kind to each other this Christmas and New Year holiday period is to help us to help you and to save 000 for saving lives. New South Wales Ambulance today, following record investment from the New South Wales Government, has more paramedics, more ambulances, more aeromedical aircraft and more call takers than ever before. But we want to be targeting those highly valuable resources to life-threatening emergencies in the community. This morning before coming here, 23 additional call takers finished their induction training and will be on operational rosters across the holiday period whilst most people take a break. Last week, 25 graduate paramedics completed their induction training and have already moved across the state of New South Wales and are out treating patients in the community. We can all be extra kind to each other this holiday period by saving 000 for saving lives. Thank you.
No, I think we've always said along the way that we'll tailor our settings on the evidence and the facts that are in front of us, and we think the changes we've made today are modest and proportionate, particularly as we head through the holiday season. And we've put these changes in place until January 27. We think they're fair and balanced. They're proportionate, ensuring that we are able to keep people safe. Obviously, the biggest concern that's come through over the last 24 to 48 hours has been the impact on our health staff. To have 1,500 health staff either sick or requiring testing through close contact arrangements has put that pressure on. So whilst we're seeing low numbers in ICU, or very manageable numbers in ICU, it's more in relation to making sure that our health system is able to be well manned during the summer period. We've already heard from David there in relation to New South Wales Ambulance. Over the summer months, there are challenges that come our way. The changes are quite modest. In relation to masks as well, obviously we're seeing pretty much right across the board, around 85% of people in those settings wearing masks. That's incredibly positive. We obviously promote personal responsibility. I've been talking a lot about that. But certainly through consultation that the Health Minister and I have had, I want to thank Bernie Smith from the SDA, some of the employee and employer groups. We think this will just build that extra bit of confidence, particularly as we head into Boxing Day sales and over this summer period. So all in all, I think the changes we've made are modest, cautious and precautionary, just to ensure as these case numbers increase over this period of time that we get through the summer. We believe we will, and that New South Wales will continue to lead our state out of the pandemic. So I want to make a point, just to back in Dr. Chan on the QR codes. I think the issue in relation to the National Cabinet decision yesterday is it became very apparent to me that different states are in different positions. We have much greater case numbers, particularly of Omicron. Other states not in that position yet, but will be eventually. And in those circumstances, the effectiveness and utility of having QR codes in every single retail store may work in a WA setting, but don't necessarily work in a New South Wales and Victorian setting. So whilst we will maintain QR codes in those high-risk areas, which we've had in place today, just in relation to retail, we will put them in a limited way in a place that doesn't create overcrowding, but also is sensible and balanced, and we'll continue to review that setting as we obviously move through this next stage of the pandemic.
So back to where we were a week ago. Just with rapid antigen testing, you can't get those testing kits at the moment.
Yeah.
They're sold out.
Yeah.
They're saying it's going to be free. So what do people do? How do they access them? When are they going to be able to access it? How with rapid antigen?
So what we're doing here is I've tasked the Investment Minister through and our procurement teams to follow a similar situation that we're seeing in the UK, where as we move through 2022, where COVID will be still with us, we'll be still living alongside the virus, that we start the shift away from PCR testing, and as we move through these next challenges, that we'll move to a greater sense of personal responsibility and getting tested, not every day, but if you do have symptoms or you do feel sick, or you are visiting a high-risk setting, that you move towards taking a rapid antigen test rather than going and get a PCR test. So by supporting that system and providing free tests from a New South Wales government perspective, we think that will enhance and promote the take-up of that testing and get it off the ground as we move through 2022. So I'll get advice back from the Health Minister and the Finance Minister and the Investment Minister. They're currently working on putting this together. It would make sense from our end that those rapid antigen tests could be made available at our vaccination centres, pharmacists and GPs, so making it as easy as possible. And we'll also be working with Service New South Wales in the best way and the most effective way of rolling that out.
Have you set a timeline for that, Premier? How soon you want that?
Well, I'd like to see it as soon as possible in 2022. I mean, as we move through, the challenges of January, February and March, when the majority of the booster shots will need to be taken place. Currently, obviously, it's 5 months. That may move. We'll wait on the advice from ATAGI and the federal government in relation to that. But once we get through that phase, it's going to be very important, as we are living alongside the virus, that this just becomes part of the ordinary course of our lives. So as early as possible, once I get some advice back, particularly from the Health Minister and the Investment Minister, we will set that out. But what we want to do is make it as seamless and as easy as possible for everybody right across the state. Angura? We're just asking, personal responsibility and common sense, and just be cautious over the Christmas break. And people are doing that already. It's very clear that, and I want to thank everybody for their efforts. It's, the government provides settings from time to time, but ultimately it's on the people of our state who follow those settings, are socially distancing, are washing their hands, just the basic things that we've been talking about over the last 2 years. If we can continue to follow that approach, we'll get through this, and we are getting through it. I think if you look at the information to date, and as the Chief Health Officer, Dr. Chan, has pointed clearly out today, the early signs in relation to Omicron are incredibly encouraging. So it's time for calm and just be cautious, though, as we go through this period. I want to thank everybody across the state. It's been a difficult year, particularly as we came to the end. It seems a bit like Groundhog Day with last year and the issues with the Northern Beaches. but we're in a much stronger position today as we lead the country out of the pandemic because of the vaccination rate. And that vaccination rate, we can follow that up, which we're doing already, with that strong booster program. We are going to get to the other side of this before the other states, and that's obviously everyone's going to go through this at a different pace. But if we continue to show caution, if we continue to just go out, have a great summer holidays, have a great summer break, we just think the changes we're making today are proportionate and ensure that as those cases increase, which they will do over the summer period, that we're able to have our health teams here and our ICU wards well staffed as we enter this new stage.
You say you only get tested if
Yes.
you've got symptoms.
Yes.
Isolation requirements also changing if you're a close contact, or
Well, we made those close contact changes last week, and we think they are sensible. In fact, it was a matter of discussion at National Cabinet, and I think from a national perspective, New South Wales has the best model when it comes to close contact requirements. But it's just crucial. It's just crucial. One of the key messages we have today for viewers across the state is that if you don't feel unwell and you're not required to get tested by New South Wales Health, please don't, because your spot in the queue is taking the place or slowing down people who are sick, who are required by New South Wales Health to get tested. And in addition to that, that also slows down our capacity to get that test result back. And particularly when we've got a situation where many people in New South Wales are travelling around the country for holidays to see families, we want to get, and please be assured, we're doing everything we can to get those test results back as quickly as possible. But if we can reduce the people who are lining up in those queues who don't need to do so, that would be very much appreciated from the government and from everybody across the state who really does require to get one of those tests. And the last point I'd make in relation to that is I continue to look forward to to work with the other state premiers about minimising and reducing that requirement because it's the taxpayers of New South Wales that are paying for those tests for people to travel interstate, and the queues are substantial and it's slowing down the testing that's also affecting the health response.
So with these QR codes then, I mean, you're effectively introducing them to such low risk settings that you're talking about, that then people will get confused inevitably by those case alerts and then possibly take their spaces in the line that you don't want them to. So why
Are you saying on the QR code?
On the QR code, so why introduce the alerts back when your ultimate message is just get tested when you're sick?
Well, it's clear on that alert, and as Dr. Chan pointed out, it does provide a reminder to you. When you get that Service New South Wales alert on your phone, what it does say is monitor your symptoms. If you feel unwell or are contacted by New South Wales Health, please go and get tested. So that's important, and that provides, and I'm sure from my discussions with the Prime Minister, that's the logic behind the national approach in relation to ensuring QR codes remain in place. But in Victoria and New South Wales, we are in a different position, and with higher case numbers, what we don't want to see is that alert leads to unnecessary testing. So it's a very important sign if you can make the point or make it clear as we communicate to the people of our state that only if you feel unwell or are contacted by New South Wales Health, then get one of those PCR tests, because you're taking a place in the queue of somebody who needs a test. So the reason, and we always, as we said, throughout the pandemic, we'll reassess our settings from time to time, and QR codes is no different. I think it's important where possible we have a consistent national framework, so we understand that, and that's why we brought it back in a limited way in low risk settings. And to Dr. Chan's point, it does provide everybody a reminder if you are unwell to get tested. But the flip side of that is if you're not unwell, you're not contacted by New South Wales Health, please don't get tested. No, we've always said we tailor the settings to the circumstances that are in front of us. That's what we've said throughout the entire pandemic, and that's what we're doing today. The concern that we've seen here in the last 48 hours generally is primarily based on our health staff. And we want to make sure the health system is resourced. There are many other pleasing factors. So when you're looking at what we're seeing in front of us today, there is a lot more good than bad. A lot more good than bad. The early evidence in relation to Omicron is it's 5 times less severe than Delta, and that's incredibly pleasing. We have seen an increase in ICUs, but it's still very manageable. We always have our number one priority here in New South Wales is to keep our people safe as we learn to live alongside the virus, and that means from time to time, as we've always said, we will tailor our settings accordingly. And at the moment, we believe that the settings that we've made today will ensure that we have a strong summer, people remain safe, but in addition to those settings, we just ask everyone across our state to be cautious over Christmas, treat everyone with kindness and respect. We'll get through the other side, and we're going to have a strong 2022. Sorry, Liz is.
Being able to keep the health system running with 1,500 staff that are furloughed at the moment.
Yeah.
But this is not just a health staff issue. This is happening at businesses across the city.
Right.
We're talking to restaurants that have had to close down, and they're
Yeah.
told this is what living with COVID looks like.
Yeah.
A, are you going to give them support? They're having to pay staff who are on sick leave just to isolate. And B, when will we get to a point where if you've got a sniffly nose, you're not locked up for 10 days?
Well, that clearly moves through 2022 as we move through the pandemic, and ultimately there will always be challenges and disruptions. As we learn more about this variant, our number one priority is to keep people safe. And whilst the early signs are positive and incredibly encouraging, we need to make sure that we do tread with caution. We believe the settings that we put in place. And the alternative is that we close everything down. It's very similar to the challenges that we've seen in the school system. We brought kids back into the classroom as quickly as possible. That meant from time to time, schools had to close. That was a challenge and difficult, but in the main, schools remained open. We got kids back into the classrooms. The same thing will occur here as case numbers increase and close contact numbers increase off the back of it, that there will be some disruption. That won't be unique here in New South Wales. That will occur across the board. But this is the way that we have to move through this next section of the pandemic. There'll be disruption from time to time. We believe the change we made to the close contact definition have made a marked improvement on that front. And I've certainly heard from the hospitality industry that they've seen a change, but that will be offset, obviously, as cases increase. But this will be a challenging time as we go through 2022. There'll be difficulties, but in the main, we're in a much stronger position because we're not locking down, we're staying open, but living with the virus in this interim period means there will be challenges. We will have to tailor the response. There will be inconveniences, and I know that people across our state are tired. It's been a tough year, but we are in a very good position. Now, that doesn't mean there won't be inconveniences. It doesn't mean that, to your question, that people will have to isolate if they are a close contact, and we've narrowed that down now to households. We've narrowed that down to unless there's an event which health deems as high risk. So we believe we've got the balance right. I accept there are going to be challenges, but in the main, we're in a very, very strong position. No. Well, we always take advice from our public health team and our health team, and from time to time that we manage that advice up with our economic advice and mental health. That's what we've always said throughout this pandemic.
But when did you recommend it?
There's been a number of recommendations that we received from public health. But it's always a balance. This pandemic is a balancing act. We balance the health needs with the mental health needs, with the economic needs. And as the Minister Hazzard often says, the public health advice alongside the overall New South Wales health advice, because there are impacts of every decision we make. And in the main, the decisions that the New South Wales government has made has kept our state incredibly strong. People are working, people have been kept safe, we have a very low death rate. Our ICU presentations at the moment are incredibly manageable, particularly given where the case numbers are. So we're in a very strong position here in our state. And I think the slight changes that we've made, just as we move through until the 27th of January, are modest but cautious to make sure that New South Wales gets through the holiday season. And they will play some role, but ultimately personal responsibility plays the key role. And the key role is that if we can practice socially distancing, if we can follow the health advice in relation to some of the change that we've made today, but at the same time using common sense and looking out for one another, particularly as we enjoy the holiday season with families. Just be cautious and careful as we move through, and we'll get through this just like we've got through the last 18 months. Sorry, what was it? Sorry, I missed that first part.
People who've not had to get elective surgery need to get tests done.
Yeah,
They
yeah.
haven't had their testing done in time.
Yeah.
We're only just catching up to the tests to the
Surgeries from last year.
lockdown.
Yeah.
Are you confident there's enough in place to protect the healthcare system?
Yeah. So, and that's a very good question. So last year, obviously, we had to postpone. And earlier this year, we had to push back some elective surgery, and the health team have done an amazing job during this period in bringing that elective surgery forward. As we will end up being in the same position if, as we would expect, that ICU presentations increase and hospitalisation increases, that we will need to make some of those changes again. So we just ask people to be patient. At the moment, though, we're in a very strong position, and the health team, and I might ask the Minister to make some further comments on this point to give a bit more direction, that we're still bringing forward and catching up to those elective surgeries that we had to delay from last year. The question in relation to testing is also important, because we need to get, that just goes to the point, I would really appreciate if on the news tonight and in the papers you really make this point about testing, because the increase in testing, whilst we appreciate those great numbers, is important. If you don't need a test, please don't get one, because that also delays the turnaround time, and that's affecting interstate flights and travel, and it's affecting things like surgery. So it is a concern, but if we can get tests provided for those who need it, that will ease pressure. And secondly, I think if you look at where the health system is at the moment in the elective surgery component, we are on track. Having said that, it would be my expectation as we move through 2022 and ICU presentations increase and hospitalisations increase as well, that we will have to move around and push back elective surgery as we did last year. I don't want to preempt it. I just want to say, obviously, that's what we've done in the past. It's likely to be done in the future as we move through this next phase. And I just ask for everyone's patience.
Can we talk about boosters as well, Minister? Just in terms of boosters, as Dr. Chan said, the booster is really what's going to stop the disease spreading so quickly through the community. It's spreading among 10 to 39-year-olds. We're effectively in the same situation we were 6 months ago. Those are the last people to get their vaccine, which means they're the last people who are going to be eligible to get their booster. Is it a situation where there's a clinical reason why the booster can't be brought forward, or is it simply a rollout?
Well, look, that's been determined by the National Cabinet. I've already made very clear, Liz, that I would like to see the federal government get advice from ATAGI to bring forward the vaccinations from the 5-month point to the 4-month point. But the point that I made the other day when I said that, and I've said it a couple of times, is you'd also have to understand it does actually introduce a lot more people who would be eligible, and therefore a lot more pressure on the system. So there's nothing perfect in a pandemic. New South Wales has done it pretty well. We've been the open gate for the whole of Australia, basically, right through. We've never closed our gates completely. Victoria closed their gates for a number of months. So I think getting it back to 4 months would be good, but we've got to understand that if they were to come to the position that I'm actually asking for as Health Minister here in New South Wales, there are also issues that come with that. There's no step that you take that doesn't have some downsides. Can I also just answer or just clarify a point you just made, and that is that the majority of cases at the moment, the positive cases, are actually young people. 10 to 39-year-olds occupy 70% of all of our positive cases. And that's why it is so important that whilst we try and do this in a balanced way, and we try and take incremental steps in terms of health orders, we're also saying, Dr. Chan said it, I've said it, the Premier said it, if you're actually going somewhere where there's a whole lot of young people, for heaven's sakes, look after yourselves and don't actually start hanging too close together with people that you probably don't know all that well, because there may well be quite a few people there. There may even be one. As we saw up at Newcastle, one person went from a party boat and turned 250 people into positive cases in one nightclub in one night. So we're striking a balance of Personal responsibility. Get sensible, folks. Don't try and mingle too closely with people you don't know, and in some cases even with the people you know. But also, if you can, get vaccinated. Now, I've just said earlier, Liz, that there are 35,000 places that have gone wanting in the last week and a bit, and that means that people could have gone and got them, and some of those would have been young people who did opt early on to take the AZ. You might remember that was a year ago's debate, or back in February, March, April. It seems like we have stages of this pandemic, and quite a number of young people did have the AZ. A lot of older people obviously had it because it was limited at one stage to over 60-year-olds, or primarily for over 60-year-olds. Those folks should definitely go and get the booster. But I want to just correct one thing you said. The booster will not stop the pandemic. What will stop us being admitted to hospital is the boosters plus the social measures that the epidemiologist, Dr. Chant, has actually emphasised time and time again. And that is, keep your distance. If you've got any symptoms, go and get tested, and just be sensible about how you're actually conducting your activities. Wash your hands, do all those things that have actually done us so well during the pandemic.
Minister, what do you say to...
Sorry guys, maybe I'm just getting a bit over it, but one at a time, and you there, and you if you want it. There you go.
What do you say to these calls that have come from Canberra in the last few days about reopening state vaccination centres?
Yeah, look, federal government's done a pretty good job in lots of ways, but I don't agree with them on that one. I think in New South Wales, we had 40 major facilities, vaccination facilities. We still have 40 major vaccination facilities. Some of them have swapped around. So Kudos Stadium, which had massive capacity, although it was not ever really used to maximum capacity, was substituted with a new facility out in the western suburbs. We've actually still got 40. I know maybe one or two other states have had to wind back, but I also say this. The reason we were able to man those, the reason we had enough staff, in those various vaccination centres was, as was just discussed by the Premier, we actually had to wind back on direction from the National Cabinet. The elective surgery, Category 3, some Category 2, and so we had staff available to do the medical side. We also had fabulous staff, people with interpersonal skills from places like Qantas and Virgin and Rex, who were able to do the guiding around the centres. We don't have that anymore. Our staff are actually back at work, they're doing their operations, they're in the wards, and they're all exhausted. So my strong advice to the federal government is, yes, we'll do our bit, and my response is we'll do our bit as we always have, but GPs and pharmacists need to actually be given sufficient funding to be able to have valid business models. You know, if you're a pharmacist and you're already tired from 2 years of this pandemic, 23 months actually on Christmas Day, then if you're only making, I think $16 a pop for a jab, you're not going to be too keen, because you can make a lot more money by selling things across the counter, doing your prescriptions. So I think that the fact that the federal government have now said they are going to step up and actually pay additional funds to GPs and to pharmacists, we should all say thank you to the Prime Minister and thank you to the Federal Health Minister, and hopefully that will make a difference and turn those perhaps otherwise restricted circumstances to more viable circumstances for GPs and for pharmacists.
Thank you.
Look, just a few months ago, I remember one particular news channel carried a picture of a New South Wales ambulance outside the Alfred, one of the most famous hospitals in Victoria, and we knew that we had some of our retrieval specialists, our highly qualified doctors that jump out of helicopters and save us. They were down there working for the Victorians. We've sent other staff down to Victoria during some of their other peak times. I'm absolutely certain that if we do need to make a call on some of our compatriots around some of the other states, they would be there to back us in. But at this point, we're making sure that our senior management, our senior executive manage the issues through the state, through the actual hospitals. Obviously, the one thing that we do know is we have a world-class hospital system with world-class, if somewhat exhausted, staff, and they work as a network. So whilst there might not be, for example, a plastics unit operating in a particular area, we can still transfer patients to other areas where the pressures are not there. So at this point, it hasn't moved to the need to actually have those additional requests into other states. Sorry, you asked the last question. And I hope it is the last question if that's possible. Good, thank you.
Minister, you haven't made any changes to household rules. And
Household,
the rules for households, the number of people in households, for example. And you've got New Year's Eve coming
you mean
up.
maximum people? Oh yeah.
You've got New Year's Eve coming up where people might be gathering the hundreds in house parties and that sort of thing. Are you worried about that being a super spreading day? And do you rule out introducing any further restrictions to that tomorrow?
As the Premier has said all along, and as I've said for 23 months, we will respond to every new circumstance. I think the phrase I've used over and over again is never say never. We're in a pandemic, 1 in 100 years, so of course we're keeping it under review. Of course we'll make changes if necessary. Of course we'll take public health advice where appropriate, along with the broader health advice. But at this stage, my view is Christmas, you know what? Last year we had the whole of the northern beaches locked down for Christmas. Sadly, we then had parts of the eastern suburbs locked down. Then we had parts of Western Sydney and southwestern Sydney locked down. We actually need a break. And we need people, as the Premier has said many times now, we need people to take some responsibility themselves. But we don't want to impose unnecessary restrictions. So Christmas, New Year, there are times for great excitement, but in a 1 in 100 year pandemic, there's time for great caution. So take it easy, folks. Don't have too many people over your house, and if you do, open all the windows or go outside. Thank you very much.
Merry Christmas.
Thank you, everybody. Yeah. If we don't do another one, to all the journalists and all the people at home, thank you very much, particularly all the journalists. Thank you, guys.